Hi, everyone. My name is Michelle Hambla, and I'm the program manager here at Wremlex Health Care Services. Today, we're going to be talking about documentation. So, what is documentation? Documentation is a Documentation, progress notes, are a tool which conveys information and reflects an individual's movement towards their desired outcomes as identified in their ISP. Documentation is used to ensure continuity of care, improve accountability, and for oversight. So, documentation is very important for service coordinators, for program managers, anyone in admin, anyone that works with your individual, because it allows us to see where they're at, to see how their plan is going, to see if the supports that you are giving them are helping them. So documentation is very important because it allows service providers, people that create the plans like me, and other service providers to create holistic plans that can benefit the individual. So you're going to be documenting on outcomes specific to your individual. But yeah, so that's what documentation is. It's very important. There are legal documents as described in the next slide. So there are legal documents that must be signed and dated. Written documentation of supports provided must relate to the individual's plan for supports. So after this training, most likely me, will be going through what the supports that are needed for your individual, and what some examples of what you could document for each support. Documentation should be clear, legible, concise, accurate, and inclusive of all the individual's response. So you want to talk about what you're doing, and you also want to talk about what the individual is doing. So, for example, if one of your outcomes is teaching the individual how to cook. You're going to write, we went to the grocery store, we bought groceries, we wrote a list, and then you're going to write what the individual did. Did the individual pick up the groceries by themselves? Did they get the idea to go to the store to get the groceries? Like anything that the individuals did or participated in is what you are going to document, and also how you helped them. Did you talk to the cashier, or did the individual independently talk to the cashier? Did the individual independently cook their food? Did you help them cook their food? Did you help them hold the knife? You're going to talk about what you did to help the individual be independent, and everything that the individual did independently. So yes, daily notes must confirm attendance. So that's how you get paid. If there's no notes, then we're not able to tell if you provided the service that day. That's also what we use to calculate payroll. What did the individual do? And what did the DSP do? Like I just explained. Notes, just write down everything. Write down how they responded. Even if you think it's inappropriate, write down if they drank alcohol, if they hung out with their friends, anything that happened on your shift. You are going to document it, so that we, as service coordinators, program managers, anybody who is an admin, can see, because we're not there with you. So when we read the notes, we should be able to see a clear picture of how you supported the individual, what you did, and how I can possibly adjust supports in the next year's plan, to better help the individual. So notes are very important. Write down everything, please. All right. So in your notes, you should include the full date and time, a summary of the individual's participation throughout the shift, where did the individual go, what choices the individual make. Focus the notes on the individual, not the actions of the DSP. So you can put how you supported, but the note shouldn't be about you. The note is about the person that you are providing services for. What went well, and what didn't go well. So you can talk about, be objective. So, for example, if you suggested, to your individual, let's go for a walk, and your individual did not like that, and it didn't go well, and they yelled at you or they cussed at you, report that, say that. Say, like, I offered my individual to go out for a walk and they yelled at me. That didn't go well. So that next time, or the next DSP that works with that individual will know, what are some preferred activities and what are some unpreferred activities. So document everything. What didn't go well, what the individual liked, liked, what they didn't like, what they liked about the activity, what they didn't like about the activity. Did they really enjoy cutting out the pieces of paper, but they didn't really enjoy gluing the pieces of paper down? Talk about like what they were able to do independently, what they weren't, everything. um, any behavioral issues, if the individual eloped, if they ran away, any medical issues, did they get a cut? Did they get a bruise? Even if you observed the bruise, even if you weren't there when they obtained the bruise or the cut, you want to document that. Like if you come to your shift and you see that the individual has like a slap mark on their face, you want to document that because for the next thing you know, their caregiver is calling Remlex to say that we um, inflicted that mark on that individual. When you can, refer to your notes, hey, no, in my notes I wrote, on this day that I saw this individual with that mark on their face. So like make sure you're documenting everything. You like notes are to cover. They're definitely very important to um, for continuity of care, but they're also to cover you and to keep you safe. And you're going to signature, you're going to sign them, and you're going to date them. So what are some unacceptable notes? Standardized or formulaic notes. So notes that you are copying and pasting, notes that look the exact same every single day, those are unacceptable. Even if the individual is a creature of habit, or they have the same routine every day, you want to document other things than the routine then. If they come home every single day, they take off their shoes, the same place, they eat the same food, you want to talk about the discrepancies or the different things about that day or that shift. So if they watch TV every day, what different show did they watch? Did they laugh? Did they enjoy it? Did they cry? Like, what was their mood like? Like, talk about, don't, there's always something new to talk about. Don't copy and paste, and do not write the same things every single day. Notes copied from previous service dates, just copying a note, a really good note, and just pasting it on a different day is not acceptable. Notes that are not signed, you want to make sure you're signing all of your notes. And notes that do not document the individual's unique opinions or observed responses. So if the note just says, I went to the individual's house and we enjoyed our day, that's unacceptable. We need to talk about everything I just explained, everything that has to do with the individual, with the supports that they receive, what they liked, what they didn't like. It needs to be detailed, please. So languages to avoid. When talking with someone or about someone with a disability, a good rule of thumb is to use language that you would use if you were talking about yourself. Use everyday language and avoid jargon. So we work with adults. Even if we're not working with an adult, we're working with a person who has a unique set of abilities and a life. So we should not be referring to individuals with childlike terms, with words like let or allow. We want to say we supported, we assisted. We want to say that we reminded, we asked. We don't want to say I took John to the restroom and allowed him. No, we want to say I supported John in the restroom by helping him wipe his behind after he was done with his bowel movement. We want to use person first language to really humanize the individual. Put yourself in that individual's shoes. If somebody was helping you, you wouldn't want them talking about you like you were a nuisance or a patient or somebody that they don't want to help, or a child. So make sure you're using very person first language. Use the individual's name. Try not to put other individuals' names in your notes. Don't just focus on your individual. If another individual, let's say that does also get services at Remlex, was there or present for the shift, you can say another client, another individual, but you want to focus your note on the person that you are reporting on. If you're referring to yourself, you can say staff, but you want the only name to be in that note is the person that you're supporting's name. So yeah. So other words that you can use: remind, asked, pointed, I demonstrated, refusal or non-compliant, use choice not. So we're not going to say they refused or they were not compliant because these are adults. They're not refusing anything. They're choosing not to do it. Um, there's no such thing as being compliant, because if they don't want to do something, so those words are not, we're not going to use those. We're going to use choose, they chose not to or decided not to. Instead of saying outing, venture, or out in the community, use we went to, and use the specific place that you guys went to. So, in conclusion, keep accurate documentation, never fudge notes. Be sure to sign and date all entries in staff notes. Um, Goal notes for community coaching and community engagement, daily progress notes for everything else. Learn to write objectively what you see and hear. Know the plan for your supports. If you don't know the plan or the objectives that you're working on, please talk to me or any of the other admins, so that we can like go over the plan that you're supposed to be working on. At this orientation, you should be getting your part 5 of the individual that you're going to be supporting. So we will definitely go over the plan. And if you don't understand, ask your supervisor. And I'll definitely be giving you guys my number and all that, so that you guys can contact me when you guys need help. So, yeah, these are some other contacts of our peeps.